is Dr. Christopher Barker with Holding Space again. I am still at the Evolution of Psychotherapy conference, um, the 40th year. Um, it's really interesting. And I mean, I want to give you some feedback on some of the workshops that I attend because I think that there's some things that are being discussed that are new. There's some things that are being discussed that are different. And there's some things that are being discussed that are not normally what I would deal with here. But nonetheless, I think they're important. Today, I had the honor of seeing Dr. Terry Real, who has come up with Relational Life Therapy. This is a family therapy, a couples therapy that is being used with great success by Dr. Real. And after having seen some tapes of him actually in progress with this, it seems amazing. I don't know how easy it is for just anybody to do. You can get trained in this. You can get certified in this type of therapy, but I think you can learn enough that you might be able to use some of the aspects of it. He said that the idea that patriarchy is dominant in our society. It's a dominant paradigm. Uh, but he doesn't mean it in the political sense. He means it in the sense of there is sort of a one up, one down. I don't want to use words like dominant and submissive because I don't think they're really relevant here. But I think there are times that men, for instance, are usually seen as the ones who are in charge, and they may not necessarily want to be, but it is a position that they put themselves in, and it's hard for them to relax and admit vulnerability. I just bought a book by Dr. Rial called I Don't Want to Talk About It. It's about dealing with men with depression and sounds fairly accurate, actually, if you ask me. But he said there's a biosphere in a relationship, in a marriage, boyfriend, girlfriend, whatever. Your biosphere needs balance. Sometimes you need to step down and yield, and sometimes you need to step up and take responsibility. And there are love demands democracy, he said. And I think that was a really catchy phrase. There are three parts of your psyche. There's the wise adult, which sort of corresponds with wise mind, which sort of corresponds with the more adult ego perspective. And this is what you want to get back to. You want to remember that this is the person that you love. You want to remember that you don't want to drive them away. You want to remember that this is somebody you want to negotiate with, that you need to be able to say things that you need to say to them, but you don't need to say it in a dominating or fighting way. There's also the adaptive child. This is the child. This is your wounded child who has found a different way of coping. This is someone who comes forward when triggered. And again, I hate to use the word triggered, but it fits. This child has found a way of coping, but it's usually a way of fighting. And that child will come forward and it likes revenge. It likes to hurt and it will fight back. And if you win, it'll just hurt you back. So the adaptive child is somebody that you should be aware of. And when this part of you steps forward, you should take a break, take a walk around the building, breathe, say, like, this is my adaptive child coming out. I really don't want to do that right now. So I'm just going to take a break from this and we'll come back and approach it later. And there is a wounded child, which when you do inner child work, this is the part that you want to get in touch with. This is the part that you want to reach down into and find yourself and offer him or her loving support, being able to see where the wounds come from. And there's frequently a trauma base to this wounded child. So you want to see, when was this child wounded? Who did the wounding? What does this child need? And when you're able to get in touch with those things, when you're able to love yourself, then it's easier for you to love someone else. And if by some chance Trail's watching this and I'm getting part of this wrong, forgive me. I just had one workshop, actually two workshops on this, but it's absolutely fascinating. There are three phases. There's the waking up phase where you figure out what the problem is, and you don't need to have somebody come in and tell you every single fight that they've been in. You just want to get a picture of what's been going on and some idea of what the dynamics are. And that's joining through the truth. You will sometimes have to say to people, the way you're talking to your wife it's verbally abusive, but I know you're a better person. So Let's recognize what's going on here and let's try and get to that better person. You are a good person. You know that you can do better than this. And it's not what she wants to hear. It's not going to help the relationship. Being that kind of honesty, angry complaints don't work. Loving confirmation does. And he gave the example of if you are in a car with somebody and they're driving and they are not a good driver. They're always moving too fast, they're tailgating, they're doing things like that that make you upset. The first inclination most people have would be to yell, "Stop that! What are you doing? Don't you think you're going to kill us?" That's not going to work. What if you said, "Honey, I know you love me. So this is coming from a place where I'm loving you back. I need you to, for my sense of well-being, for my sense of safety, I need you to slow down and drive a little more carefully. It would make me feel so much better." And I mean, it's really hard to have an angry comeback to that. It's really easy to say, "Oh, okay." And I think in most people's experience, that type of approach would get you from far, so much farther than fighting, than insults. We find defensive ways of dealing with things, and sometimes they are shutdowns, and we are walled off behind these things. And for the therapist to be able to step forward and say, that is not the most productive way of approaching this. Can you think of a better way? Can you think of a way that comes from love? And it requires being, sometimes you have to just sit in silence. Sometimes you have to be directive, but you don't have to be teachy. You don't have to be instructive. You don't have to say, oh, this is your, inner child coming out. This is the sort of approach where you are observing, you are interpreting, you are confronting to some extent, but with kindness and with love and with the awareness that these two people wouldn't want to be here in your office if they didn't want to try and work this out. Frequently, they've been to a bunch of other therapists and they haven't tried this method before. But I mean, from what I saw from the demonstration, and of course, please look it up and see for yourself what you can find out about it. Relational Life Therapy, RLT. And I found it really instructive. I'm going to continue to learn more about this, and it's something that I'll be able to use, I'm sure, in my practice. Um, I'll be presenting more information from workshops that I attend. It's absolutely fascinating here. And the diversity of people, the diversity of viewpoints, people from all parts of the field. We heard a description from Dr. Amen this morning who talked about brain health. He wants to get rid of the term mental illness and replace it with brain health. And there are things that you can do to make your brain more healthy. That is a more positive focus, and that's the direction that mental health has been going in for some time now. Martin Seligman started when he was president of the APA, started doing this, and I think a lot of people have fallen into line with it. What's going right, and what can we do to maximize your gains? I'll be giving you more of these as I learn more, sometimes just observations about things. I'm going to see if I can get somebody to sit in with me for an interview. That would be really nice. Frequently, people finish their workshops and they scurry off, but I might manage to trap someone. Until then, thanks for holding space while I rambled through this. Like, subscribe, comment. Let us know what you want to know about. If there's something that you want to hear about, if there's something in psychology that you want me to see if I can find out more about while I'm here, I'm open to it. But keep watching, keep holding space, and let's keep holding space for each other. Thank you.